I'm going to do every hour of today's show. It's Friday. We made it through May. Next week, of course, we're into June. As Brett Baer likes to say over on Fox News, we are one day closer to being over with this entire catastrophe that the nation has faced. There's a lot of tension and violence, looting, problems throughout the country over the death of George Floyd in Minneapolis. We're going to dive into that, but I'm going to do two things every hour today. Number one, I want to apologize. I'm thinking about a guy named Aaron who texted me yesterday when we had a debate or a conversation, I should say, about masks. And incidentally, before you roll your eyes and say, oh gosh, here he goes again, masks are a big part of what we're going to have to decide to do as a nation. Mandatory masks, it seems to me, fining people, what Governor Northam in Virginia is trying to do. You go outside, you must wear a mask in Virginia. And I presume you'll get arrested if you don't, maybe handcuffed, which is garbage. But as I shared with you, there are a lot of people who work in the service industry, people behind counters, people who come in contact with people who say, a mask gives me a little bit of confidence to be able to come to work. And the light kind of went on. I thought, wow, if I can help that person feel better about working, why not, right? So we had a little bit of a debate about it yesterday, and a number of you called because a lot of people are pushing back about masks. And I said, well, the doctors and the scientists, the CDC, Dr. Birx, Dr. Fauci, social distancing, wearing a mask, it's all what we're supposed to, wash your hands. Then I saw something on social media last night about the World Health Organization. About fell off the couch because it was not just one person, not one expert, not one public health specialist, but two on different places on the World Health Organization's website. Let me first give you Exhibit A. This is Christine Francis, who is with the World Health Organization, and the guidance of this esteemed, august organization about the wearing of masks in America.
Medical masks like this one cannot protect against the new coronavirus when used alone. When you wear them, you must combine with hand hygiene and other preventive measures. WHO only recommends the use of masks in specific cases. If you have cough, fever, and difficulty breathing, you should wear a mask and seek medical care. If you do not have these symptoms, you do not have to wear masks, because there is no evidence that they protect people who are not sick. However,
okay, so
if
that's
you are
Christine Francis from the World Health Organization. Then there's another lady. Here is a different, maybe you'd think, well, she must be crazy. Maybe somebody hijacked the video studios of the World Health Organization. Well, there's another lady and a different place on the WHO website. I mean, I am not making this up. This is Dr. April Baller, public health specialist for the World Health Organization, reiterating the guidance that you just heard from the WHO, that not only are masks ineffective for healthy people, but healthy people, therefore, shouldn't be wearing them.
If you do not have any respiratory symptoms such as fever, cough, or runny nose, you do not need to wear a medical mask like this one. Mask alone can give you a false feeling of protection and can even be a source of infection when not used correctly. Masks should only be used by healthcare workers, caretakers, or by people who are sick with symptoms of fever and cough. Why?
Okay,
because healthcare workers and caretakers...
I throw in the towel, and I am sorry to Aaron who texted me yesterday, and I called him out a little bit on air when he said, Mike, where's the science to the masks? And I said, what do you mean, where's the science? That's what they tell us. Well, now they're telling us, evidently, a mask is unnecessary, which is going to come as a real shock to, Disney World, Governor Cuomo, all the stores and businesses requiring masks. This will be a real newsflash to Governor Northam in Virginia. I give up. I come to work prepared. I'm studying. I am trying to be sure to present the correct information to you. I feel an enormous responsibility to get it right. But I should have learned my lesson yesterday when so many smart listeners were pushing back and pointing out that there is an absurd inconsistency from our health officials about just about everything having to do with coronavirus. How about the news that there now is no real evidence that it does not spread easily versus contaminated surfaces? The Centers for Disease Control now say the coronavirus does not spread easily from touching surfaces or objects, which again comes as a newsflash to everybody who's been wiping and spraying and sanitizing. It's unbelievable. You know what? I'm done. I give up. I'm not going to try to interpret this. I'm going to do what I feel is right for me, and you need to do what you feel is right for you. And I apologize for disagreeing with you on the very contentious issue of masks. If somebody telling you have to wear a mask, you might want to point them to the World Health Organization. Because if you're healthy, according to the WHO, if you do not have symptoms, they just said you don't need to wear a mask. Unbelievable. Now, here's the second thing I'm going to do every hour today. I'm gonna ask for God's guidance and strength and wisdom and healing. You're doing something that is so unbelievable with our Angel Tree Prison Fellowship campaign. This is the final day, so don't worry. This is the last time I'm going to mention it. All I know is that right now, 751 children in America whose mom or dad is in prison will receive a gift box because of your love and generosity. The gift box is going to contain over $150 worth of groceries, sporting goods equipment like a basketball or football or soccer ball or baseball, a Bible, Bible study materials, a letter reminding the child who is frightened, who is without his or her parent, who is alone, who is probably in an impoverished, low-income inner-city neighborhood. That box of love contains a letter that reminds them that God does love them and God will not abandon them. And because of your generosity, we are now at 751 children being sponsored for these $200 boxes of love. So I'm going to pray. And my prayer is pretty simple. But I just want to take a few seconds to first express my appreciation for your support. And on this final day, I'm hoping that maybe your heart will be touched and you will make a final push donation to get as many children sponsored and loved as possible. Dear Heavenly Father, may our listeners who have already been so generous and gracious be touched on this final day of our Angel Tree Prison Fellowship campaign. May your loving spirit, may your guiding hand lift these wonderful people up so that they might make a final big push donation by going to my website and supporting these children. Give us the strength to do the right thing. Your love envelops us all. Please lift up everyone listening to this show, and may you touch their heart and realize that if everybody listening just did a little bit, if every listener to this show donated $25 or $50, you know that that would lead to hundreds of children, American kids, being supported by the kindness of strangers.